known as Obamacare. Do you support it fully as it was passed by Congress? Do you see any need for revisions to it? Or do you believe it should be repealed?
Oh good, I get the easy one. The, Obamacare, quite frankly, I don't understand it. I like what they were trying to do. In my estimation, everyone is kind of wondering why their insurance, health insurance, keeps going up and up and up when you don't use it, and why is it, I mean, mine's gone from $300, I think, to almost $700 a month. I thought that was the idea behind the healthcare, was to help us figure that out. It wasn't. So I have no idea. I don't understand it. I think it should be repealed. Getting back to what everyone here at this panel is, government isn't the solution. I think competition is, and I think for healthcare we have got to talk to the insurance providers and whoever is controlling this to get it under control.
Yeah, we need to repeal Obamacare. To understand where the pressure came from to create Obamacare, we've been hearing for years and years, mainly from the liberal press and Democrats, that we've got a healthcare crisis and the government needs to solve it. The problem with that is that to the extent there was a healthcare crisis, the government created it. And this is, you know, they act as if, oh, well, the free market in healthcare failed. Well, the problem is we don't have a free market in healthcare. Back in the 1950s, healthcare was only 3% of GDP. 3%. Today it's 19%. What happened? How come healthcare costs have skyrocketed over the last 40 years? Why have they gone up so much faster than the rate of inflation? Well, the reason is because the government has been massively interfering in the healthcare system. And as Milton Friedman said, if the government managed the Sahara Desert in 5 years, we'd have a shortage of sand. So the solution to the problem, you know, you say, oh, well, the healthcare system was halfway taken over by the government to begin with, and it's created a crisis. So the solution is for the government to take over the other half? No, the solution is to start going back towards a free market in healthcare. And, you know, we've got Medicare and Medicaid, which is a huge portion of the healthcare budget, and then you've got this insane system of tax incentives, which encourage somebody other than the person who's getting the healthcare to pay for it. Now, if somebody else were paying for your clothes, you probably have a really nice wardrobe. So that's what's created the dysfunction, and the solution is to get back to a free enterprise system in healthcare.
Obama health care benefits medical organizations, drug companies. I think everybody seated in the United States must have health care, but at the same time, people have a responsibility, not for free everything. Therefore, common sense, have to participate in fitness activities. Fitness is best medicine. We spend so much money, we'll grow up, therefore drug company increase price. My point is I will, as Biden said, negotiate price of drug. No, demand to cut price of drug because you pay for this. If the pharma company will not do it, buy drug from other countries, from Canada, Mexico, Europe, or this. And the nation spends talking about abuse children. It is dirty politics. Some name it me unique political phenomenon because I see what other don't see. You see, medical organizations, drug company need future supply, diabetic people. Therefore, they corrupt politicians. If politicians do not concentrate on prevention medical problem. But prevention is best. Therefore, my point is I will give to each child jump rope. They will do competition with me. It will be save big money for our country. Thank you.
I vote to repeal health care. I think that the country spoke loudly at our 2010 elections when they voted people in that had promised during their campaigns to repeal the Health Care Act. Health care for 350 million people is more than impossible. My husband belongs to the VA center, and I think the VA across the country services about 22.7 million veterans. They provide a good service, but people fall through the cracks. In the past year, my husband has had 5 doctors. He's not even met his doctor, who is his doctor now. And the VA just has an overload. Even when he takes tests, he has to call weekly to get the things reviewed. 350 million people, we would not be able to take care of every single person and their needs. We need private community health care centers. Salud is big here in the Yamhill County, and I do a lot of fundraisers for Salud, and they take care of the farm workers. The farm workers can go to a mobile lab, or they can go to one of the Salud centers, and they do a fabulous job with health care. And we fund that. We fund that privately by doing fundraisers, by helping our community. People in the community know what the community needs, and we do take care of our own. We are our best service providers, and healthcare is so important that we need to get it back where the community is in charge of the healthcare clinics. Plus, I love my doctor. If I didn't have health insurance, I would pay for my doctor privately. There is no other doctor I want than my own personal doctor. Thank you.
Well, I think we should focus on health care and not health insurance. We've made this so, we have created this industry where the well-being of human beings has become a business. Every other person is being diagnosed with something, and I think when you go to a doctor, they scare you more than they're trying to like make you feel better. It's like they put you on drugs, and then it's like, when you get off, it's like most of the world is not doing that. I had a friend recently, she was diagnosed here with cancer, and the doctors here told her that she could never, it would never be cured. She went to China for 3 months. She got her Eastern medicine treatment there, and she came back and she had no disease. And I was just shocked. She went to the doctors back here, and they were like, well, they couldn't explain it, what herbal medicine or what Eastern medicines they used over there. But I think America is fairly new. We need to learn from people around the world. They've been doing this for a long time. We need to, yes, we may have the most modern technologies, but we're not. We need to focus on the well-being of people. We need to go back to Eastern medicines and Chinese medicine and herbal, homeopathic, natural medicines. They have lots of healing power in them. We need to learn from that. Our medical school, we don't need to put people on drugs there's a time for medicines, but there's also a time for learning, and we need to look at it very critically. Two of my sisters are doctors, and I see how most of my family members are doctors, so I feel like it's become such a business, and it's like anybody comes in, I'm afraid to go to my sister because they will just hand you meds, oh, you should take this for this, and I'm like, I don't need that. I think we need to take people off meds. We need to care about people's well-beings and look at it critically. Thank you.
One of the real benefits that I've received by just coming to these forums gives me a chance to listen and learn, and you can pick up lots of good ideas. But here's my take on the health care plan. When you send me to Washington, D.C., and you might, but when you send me to Washington, D.C., the first thing I'm going to do with my health care plan is to cancel it. I won't need it. You folks are going to pay for it.
That was succinct. I like that. Okay. Yeah. We have placed our lives in the hands of a bureaucracy with this abomination care. This is ridiculous. All right, people, help me. Work with me. This doesn't make any sense. the 9 rules of communist revolution was sort of found on a piece of paper in a police raid in Dusseldorf, Germany in the year 1919. Number 6 was through government extravagance, destroy the credit, cause fear of inflation and general discontent. It also had said number 1 was get control of the youth, get them away from religion, get them interested in sex and athletics. Number 2 was get control of all means of communications, the news media. All these things are being implemented. It's all designed to control us. If they can tell us, you do this way, you drive your car that way, you have this kind of light bulb in your house, you have a car that emits this amount of pollution, or we're going to cut you off of your health care, or we're going to do this or that, and they're going to just decide that you are no longer somebody that is necessary for society because maybe you're too old or too infirmed. They'll just give you a little extra dose of morphine and call it a day. We can't have that. We've got to repeal that, and it's so insidious, the mountains of paper that this thing took up, and they funded it within it, which is also insidious. The whole thing is Nightmare on Elm Street Part 5. Thank you.
Okay, starting with Robert, 30-second follow-up if you care to respond.
Thank you. And it is competition, getting back to what actually everyone has said here in Sava. The government needs to get out of healthcare. We've got to. I do not understand why we pay more for drugs here than the same drugs overseas. I'm not sure how that. My guess is it's because of the government intervention, and we just need to get out of that.
Yeah, market reforms could bring the cost of health insurance way down. For example, each state now licenses what insurance companies can sell insurance in that state. So you only get a few companies competing against each other in the state of Oregon. Well, if you had a national law that superseded that said every health insurance company can sell insurance in every state, you have 30 or 40 companies competing for your business. Competition brings prices down. So those are the kinds of market reforms that could solve the problem instead of a big government bureaucratic approach.
I like your 30-second follow-up. You see what I forgot to say. I against this Obama health care because a government may not dictate young people to buy health insurance. It's not government business. Thank you.
Health care is important to all of Americans and should be fair to all Americans. And if healthcare companies could compete across state lines, and tort reform was a huge part of the healthcare legislation, it would dramatically reduce healthcare costs, and it would be there would be an affordable option for all Americans. But it is an option. Thank you.
I believe we should look at how healthcare is being done in Canada and Europe, and how they are able to provide healthcare services to most of their citizens, and learn from some of their best practices and bring them here to the U.S. Thanks.
Follow up to the healthcare. Do you want to say anything else?
I think I did my follow-up, John.
That was actually your statement. That's why I said it was succinct. You can say, did he have a little extra time? I don't think he realized it.
Yeah, if you need a little extra time here, Dan, because you thought that the preceding allotment was for your follow-up.
It was actually your statement.
Thank you, John. That was my statement,
okay.
And that was my follow-up.
All right.
And I know that was tongue-in-cheek, but the sad thing is that's true. Okay.
I love it. This is great. I'm learning so much. Okay, I didn't buy into that whole I can't have health care unless I have a job thing. I started not buying into that when I first became unemployed back in the 80s. And I've been buying my own health insurance, and I work as an independent contractor working with people on their advertising. I'm an advertising consultant. I've been paying for my own insurance for the last 10 years primarily, and it's through LifeWise Health Insurance. I pay less than $200 a month for myself and my son. The trick is you need to have a high deductible.
All right, we have roughly 45 minutes to go. We're going to take a 5